like to have a fairly open format, so if you guys have any questions as we go along, certainly fine. Stop me at any point. You can do that at the end as well. A little background about me. I'm a graduate of Union College, just right across the street. Got my bachelor's in science in biology, pre-med at Union, where I met my wife, who is a microbiology professor at SEC here in town. After graduating from Union, I spent 2 years in Portland and Seattle doing a naturopathic medical program. And when I say that to people in the Midwest, they really have no idea what that means. Naturopaths are the primary care doc of natural medicine, very much utilized on the West Coast, East Coast, and the Southwest. Colorado just last month developed a scope of practice for naturopaths. So really we have no scope, absolutely no scope in the state of Nebraska right now. You could go to Red Clover Open Harvest and get as much legal advice from someone in their body on an aisle as a naturopath could legally give in Nebraska as it is right now. So that'll change. So I went on and got my chiropractic degree, and that allows me to open up my scope a little bit. Probably a lot of you at some point have been to a chiropractor. We do that. We also do a lot of broad scope natural medicine in our practice, and that's what I'm going to talk about primarily today. How many of you have seen the construction on Prescott? It's happening, yeah. So that's in front of my office right now. We have an excavator and a road grader and everything else. So that's my office. Just down the street a little bit. So it's an honor to be able to present to you guys within walking distance here. All right, some of my learning outcomes today, talking about food sensitivities, food allergies, and kind of the effects on the body are going to be this. Hopefully to live as healthy as possible so we can serve to our fullest. How evidence-based natural medicine can be applied to the treatment of chronic inflammatory diseases such as irritable bowel syndrome, and we'll abbreviate that as IBS for the most part from here on out, Crohn's disease and arthritis, the role of the gastrointestinal or the GI tract in inflammatory processes, and dietary and lifestyle influences on chronic inflammation. So just a quick poll, how many of you have friends or are yourselves thinking about eliminating wheat from your diet, or know someone who's doing that? Just raise your hand. So it's kind of the thing right now. My suspicion is that it's not going to be a fad. It's not just going to be a diet that just kind of comes and goes. I think as we learn more about food sensitivities, particularly wheat, we may find that it affects more body processes than we realize. So let's talk about that a little bit as we get into this. Of course, kind of a tongue-in-cheek joke here. I want to learn from you guys too. If you guys have any questions, any experiences, feel free to share those. Bit of naturopathic philosophy, the healing power of nature, identify and treat the cause. Not to say that GPs and specialists don't try to do that as well, they certainly do. That's certainly an underlying focus of naturopaths. First, do no harm, doctor is teacher, treat the whole person, and of course prevention. Role the GI tract in health. The GI tract is about 9 meters, so about 30 feet. That'd probably be about from, I don't know, here to that door where you guys came in. So it's pretty long. The digestive tract is important for several reasons: digestion and absorption of nutrients and water, elimination, waste removal, major site of immune and neurological function. So if you've heard of different docs talk about the phrase called psychoneuroimmunology, that's kind of the connection between our gut and our brains. There is a connection there. Brief anatomy of the GI tract. The food you're eating is coming in your esophagus, going into your stomach. Pancreas sends out insulin to help you absorb that glucose that's being released into the blood. It goes into the small intestine, large intestine, and then is eliminated. Healthy gut is, let's talk about that. The innermost layer provides protection and has quite a few functions. You have the mucosa, which secretes mucus, enzymes, and hormones. The gut-associated lymphatic tissue, microorganisms, good bacteria. This is our probiotics, right? We talk about the Activa yogurt or different brands of yogurt or Greek yogurt. All of these are good forms of good bacteria. Many of them are highly marketed and have potentially more marketing than they do probiotics, so you have to watch that. The cell integrity is an important physical barrier to not let too many things through our gut. We don't want undigested proteins leaking through our gut. I like to tell my patients it's kind of like you have layers of cheesecloth. You can usually kind of get that. And if we should have typically 4 layers of cheesecloth, those with like a leaky gut, as you may have heard of that expression, they have maybe 1 layer of cheesecloth and things are going to go through that layer a lot easier than they should. Then you kind of have that autoimmune response where the body's fighting off those undigested foods. Going from the inside to the outside, you have the submucosa, which is a loose connective tissue which contains blood vessels, nerves, and glands. Outside of that, you have the muscular layer. That's good because we need to have gut motility to kind of move things along. And the serosa is the outermost layer of the gut. The protective mucosa of the digestive tract acts as a filter to protect toxins and harmful microorganisms from entering our bodies and to let vitamins and nutrients in. So foods, proteins can go through the cells of the gut. That's the transcellular uptake, and then between these little tight gap junctions or tight junctions between the cells in the gut. There are several hundred types of bacteria in the human digestive tract. They exceed the number of human cells by 10 times. That's a lot. Until a baby is born and exposed to the outside world, their digestive tract is sterile. And you guys probably have heard that before. That's true. They are quickly colonized by bacteria from the mother during vaginal delivery and breastfeeding. Good bacteria in the gut provides benefit to our health by fermentation of indigestible carbohydrates, production of vitamins, protection from bad bacteria and viruses, and priming the immune system. Some say that 80% of our immune system is in our gut, and from the research I read, that seems to be supported. Babies born by C-section and bottle-fed have fewer beneficial bacteria in their intestines versus those that are breastfed. They're more prone to colonization by disease-causing bacteria. Obviously, we're so thankful that we have cesarean sections. We would lose a lot of babies if we did. There's just a little difference in the immunity from early on for those that are born vaginally versus C-section. By age 2, the gut bacteria resembles that of an adult. That's pretty quick, I think. Moves right along. All right, this is a little hard to read. Let's talk about contributors to an unhealthy diet, unhealthy gut. Poor diet, alcohol, chemicals, stress, infection, damage to good bacteria. Can you even think of something that potentially might damage good bacteria in our gut? Yes, that's a potential insult to good bacteria. Happens quite often to the patients that I see if they're on chronic antibiotic regimens. They often need to supplement with good bacteria to reintroduce the good bacteria back in. Lack of nutrients for cell repair, invasion of the bad bacteria, and loss of cell integrity, like we were talking about before, results in kind of a drop in your immune system, food allergies potentially, impaired digestion and elimination, and often, unfortunately, disease. Okay? Inflammation is kind of the end result of this and an underlying mechanism. Kind of the new catchphrase, if you see it on Dr. Oz or different doctors, they're talking about functional medicine. Inflammation's role in functional medicine is pretty key. And inflammation is the basic way that a body reacts to irritation, injury, or infection. If you're walking out the door, going up the steps, and you stub your toe, you're going to have some inflammation in that spot. It's a natural, great process of the body to send in healing macrophages, white blood cells to that area to clean up the injury and bring in new cells. Acute inflammation would be that example. occurs at the site of injury or infection. Removal of injurious stimuli halts the inflammation. That could potentially be a corticosteroid. That's anti-inflammatory. Chronic inflammation is a pathological condition where the body makes continuous attempts to repair, contain the source of irritation and injury. The body brings repair nutrients, like we talked about, to the area to clear debris and waste and neutralize infectious organisms. Blood vessels become more open to allow blood and immune cells to penetrate the area. That's the redness. If you get a bee sting or your kid gets a little cut, that's that redness happening right away. Redness, swelling, and heat. So it's kind of neat to have visual pictures. Here's the injury right here. Here's some platelets coming in to heal that. Here are neutrophils, which are white blood cells, typical response. Here's macrophages. Those are kind of the garbage disposals, trucks of the body. They come in and they eat up the bad things that come in through that wound. And then they send out cytokines. Those are little cellular messages to the bloodstream, to the blood, to vasodilate, to start releasing more mast cells, more neutrophils, and more macrophages. So it's kind of an ongoing cycle. For some of us, if we have chronic inflammation, we need things to help kind of break that cycle. Inflammation can be good, but it can be bad as well. Chronic inflammation occurs when the unusual things that the body does to heal itself don't work due to accumulation of waste or toxicity in tissues, dysfunctional immune system, and nutritional deficiencies. Let's talk about some diseases, and you guys have heard of all these associated with inflammatory diseases. Asthma, autoimmune disease, chronic prostatitis, inflammation of the prostate, glomerulonephritis, inflammation of the filters within the kidney, inflammatory bowel disease, pelvic inflammatory disease, rheumatoid arthritis, transplant rejection, and vasculitis, inflammation of the blood vessels. So what are 4 ways to work with inflammation? Remove the insult. Obviously, if you have a thorn in your arm, take the thorn out. Replace with something that's going to help heal. Re-inoculate with good nutrients, good bacteria, and repair. Functional GI testing. This is kind of getting into modern medicine. Comprehensive digestive stool analysis with parasitology. You can do a lactulose mannitol test to test for food sensitivities, food allergies. The lactulose mannitol test is a urine test that measures abnormal GI permeability and malabsorption. You can do a secretory IgA, IgG, just different antibodies. This is one of them. That's a salivary test. Basically, the doctor sends the patient home with 4 different vials. They test via a salivary or saliva sample at different times of the day, and they're looking for food sensitivities that way. Food allergy testing you can do through a blood test as well. There's pros and cons to doing blood testing and saliva testing. Food allergy testing you can do through a blood test that measures both immediate IgE and delayed IgG immune response. I had a patient I was working with last week bring up something that they had learned through their study. For them, they can eat wheat. They're so sensitive, and they can have a delayed response up to 3 days later. So in that case, it's pretty hard to tell exactly what was it. That's where you need to be doing a food diary. Food allergy elimination with re-challenge kind of ties into the food diary part. So all of my patients that were working with IBS or gastritis, kind of a upset stomach, or often it's pain right here underneath the ribs. They vary from constipation to loose stools. We're always doing a food diary with them. What a great way that you can kind of use tools at home to kind of work on this yourself. Types of arthritis. Arthritis means inflammation of a joint. There are over 100 different types, really. In adults, the most common you've already heard of, osteoarthritis. That's your knees, bone on bone. Autoimmune arthritis, this is the rheumatoid, swollen toes, swollen fingers. Ankylosing spondylitis, that's when the vertebrae start to grow together. Lupus, psoriatic arthritis, of course, gout. Normal joint, you're going to have a nice joint space right there. Synovial fluid, which is that lubricating fluid around the joint, is nice and clear, free of any inflammation. And then with an inflamed joint, you're obviously going to have destruction of that tissue, swollen, inflamed synovial membrane. That's eventually going to wear into that bone, and you're going to have bony destruction. So, what are some things that you guys can do if you're interested? Anti-inflammatory diet is the first thing to start on. And I have some case studies with patients coming up here, patients that have done that. Anti-inflammatory herbs such as curcumin, boswellia. If you like Thai food, if you like Indian food, my goodness, what a great excuse to go get some anti-inflammatory food. Curcumin is fantastic. The Tandoor, I'm not going to represent anyone in particular, but all of those cultural foods are fantastic for their anti-inflammatory herbs and spices typically. Omega-3 fatty acids, that's your salmon, that's your fish oils. I have a few patients that are vegetarian. For them, it's their flax, it's their chia, it's their walnuts. Out of all three of those, chia is going to be top, flax is going to be next, walnuts are going to be probably the lowest. Above those is algae oil. No one's really heard of that. That's fairly new to the scene. There's a company that I use out of Great Britain that, from what I've found, sources some really good algae oil.
Is that a supplement?
It's a supplement, yep. Exercise has a good anti-inflammatory. Detoxification, just a whole plethora of ways that you can do that. And then the 4 Rs that we talked about. More basics of an anti-inflammatory or AI diet, reducing pro-inflammatory foods such as meat, particularly red meat, sugar, alcohol, caffeine, refined carbs, trans fats, and saturated fats. Increasing anti-inflammatory foods such as herbs, omega-3, omega-6 fatty acids. Obviously, focusing on more of those than those. Fresh fruit and vegetables, whole grains, little caveat right there. Ginger, turmeric, garlic, green tea. Speaking about grains, it's really good to use kind of some of the older non-GMO or genetically modified grains. Quinoa is a great one. Amaranth spelled. Have any of you guys ever tried quinoa? It's one of those fun words to spell, to say, and to eat. When you cook it, it kind of sprouts a little bit. You want to rinse it a couple times before you cook it, otherwise it's a little bit tart. If you have kids, they'll love it. It looks like little worms are growing out of it. They're not, but.
How do you serve it? What's the way to?
I should have brought my wife's quinoa recipe and put that up there. If you guys write down you can just Google it, but she makes a nice salad out of it. She'll add tomatoes. This is going to test me here a little bit. Some onions, olive oil, a little bit of black pepper. Forget what else, but it's fantastic once you kill it. So quinoa is a good go-to. Great source of protein to get you through the day so you don't have those blood sugar and insulin spikes. Common allergen foods, I usually say wheat, corn, soy, and dairy. Wheat, dairy, soy, eggs, peanuts, citrus, nightshade vegetable family. That's your tomatoes, potatoes, eggplant, peppers. I see these a lot in my patients that have what's called adrenal fatigue. If you've ever heard of that, that is when we've been exposed to stress kind of day in and day out for years, and we start having a lack of an appropriate cortisol response. Cortisol is the hormone that's secreted by our adrenal glands on top of our kidneys. When we have that kind of a response, we usually get fatigue, hair loss, weight gain, just a whole variety of issues. So For those patients, that's a key one. Natural treatment for IBS, inflammatory bowel disease, is a group of diseases characterized as chronic inflammation and ongoing activation of the immune system of the GI tract. Two primary types are ulcerative colitis and Crohn's disease. It is treated with salicylic acid compounds, corticosteroids, immunosuppressive medications, and surgery. This is the allopathic or the mainstream approach, often effective as well, because it kind of depends on which direction you want to go. Here's some pictures of that. The disease is likely a result of impaired barrier function of the intestinal lining and dysfunction of the immune system. So I'm sure that's what all of your colons are looking like right now. And for someone that has an ulcerative or an inflamed colon, you can just tell the difference right there, the redness and the swelling. When you have that swelling, obviously that intestinal permeability is going to increase, and then you're just leaking so many undigested foods through there. Then you have an autoimmune response, like we talked about. Your body starts attacking those foods. I like case studies. This is kind of where the rubber meets the road. Real patients. This is a case study of a 55-year-old female that I saw last fall with IBS and joint pain. First presented with a history of irritable bowel for 7 years. Recently treated for several months with prednisone. Nuts and stress bring on attacks. Literally, she would go to the hospital. She's pretty sensitive. Symptoms are overweight, diarrhea, constipation, so kind of both sides there. Severe abdominal pain, dry skin, white coating on the tongue, and systemic joint inflammation, meaning throughout her body. Just an aside, when you get home, take a look at your tongue and see what you see. There are often a few things that go along with that. Sometimes predominance toward too much yeast in your body goes along with that. Certainly was the case for her. Past medical history: chronic right hip, knee, and ankle pain, anxiety, depression. Medications were Effexor, clonazepam for anxiety. Diet, of course, all my patients say it's fairly healthy. Eats at a work cafeteria, snacks on cookies and chocolate milk nightly, 20 to 40 ounces of water daily, and 2 cups of coffee or tea. Unless you're pretty tiny, that's not very much water. Bowel movements every 2 to 3 days, so some slow motility. Acute mid-back pain, inability to flex her left thumb. All right, pertinent info is blanked out here. Here's some of her vitals: 5'2", 208, BP, 130/80, kind of creeping up. O2 was good, heart rate was good, weight was not. Primary findings of our nutritional blood test suggestive of elevated cholesterol, dehydrated, low-functioning thyroid, possible infection and inflammation. We also do, I haven't talked about this, we also do heavy metal hair testing. Probably not too many of you have heard of that. That's when we're seeing radon, uranium, arsenic, silver, mercury, just things that should not be in our body just from our environment. We're kind of all exposed to them. How we handle that is an individual thing. Some patients are interested in getting those out of their body. And probably can't see this too well. We'll highlight the biggest things. Total cholesterol, 445. Triglycerides, 508. Cholesterol HDL ratio was not good. Just for comparison, here is the clinical range right here. So if you follow total cholesterol, 100 to 200 is acceptably normal for a clinical range. She's off the charts on that. Okay, so we needed to find a treatment plan that might work for her, and this is what we did. Liver GI detox. Our liver and our GI, primarily our liver, helps us metabolize the cholesterol. Hers was not working well. Curcumin, like we talked about. Whole food, broad spectrum, multi. Omega-3 fatty acids, like we talked about. nutritional blood test, vitamin D supplementation. I didn't show that. She was very low. You should be around 50 for your level. She was about 30, I think. She eliminated wheat, or she tried to, in-office rehab. This is that one that I was using in my office in case you were interested. She was a vegetarian, so that's what we used for her. Follow up a couple months later, getting off of wheat is tough. And it certainly was for her. So we gave her some help, gave her some tips, and just a bunch of printouts on, patient comes back, I don't know what to eat. So helped her with that. Feels more energy since starting the supplements, normal to loose stools daily, some decrease in joint pain, just some. Encourage patient to continue the plan. Had a couple, 1 month later, a couple of cramping episodes, very minor, lost some weight, carb cravings decreased, gluten completely eliminated, which was big for her, and still doing what we recommended. Daily probiotics, continued wheat-free diet. As of early this year, she was largely in remission of IBS. It's still a struggle. We are exposed to wheat everywhere, pretty much. For her, because she was so sensitive, getting off of it was huge for her. So let's recap a few things. We have inflammation. We've reviewed inflammation. We've seen some dietary effects on inflammation or of inflammation. And let's talk about just a brief study reviewing an anti-inflammatory diet. With inflammation in the diet, you have allergic inflammation, food allergies, and hypersensitivity. You have, we use some big words here, basically means you have damage to the tissues, and with inflammation it's hard to repair that damage. You have free radical damage from reactive oxygen species, or ROS. And you have fatty acid metabolism and immune response modulation. Some of you have probably seen this if you've had it done yourself or on someone else. Another common way of testing for food sensitivities is to use a skin prick test. Pros and cons to that as well. It hurts a lot if you're sensitive, even if you're not sensitive. Hives, flushing, swelling, eczema. GI inflammation, you have abdominal pain, cramping, vomiting, diarrhea. And you can have some respiratory symptoms as well, as this other patient had with asthma. Wheezing, rhinitis or inflammation of the sinuses, the nose, asthma. Allergic inflammation with foods affects 30% of the population in developed countries, and it's on the rise. So here's 96 to 2000, 01 to 03, and 04 to 06, and that's all I have. But looks like it's going up. Good question is why? Still trying to figure that out. Have some thoughts on that. Allergic inflammation, helper T cells recruit antibody-producing B cells, mast cells, and eosinophils. That was in that little graphic that we showed you before. You have immune reactions. Here's another case study. This is from June of this year. When we have patients come in, we ask them to write down the things that they'd like to, that are bugging them, and she had a few for us. I won't read through all of those, but a lot of times patients come to me as a last resort. They've tried everything else, and that's okay. It makes for a harder case, but it's always just a real delight to be able to see changes. All right, so this is her initial blood work. She had gone to a PA in Hebron, if you know where that's at. She's from that area, and she'd gone to a PA there, and had a lot of fatigue. She's 20 years old, too young to have that amount of fatigue, was waking up 10, 11 in the morning during the summer, still not rested. That's not normal. Even when she was going to bed at a decent time. So we did, this is part of her test, but we were focusing on her thyroid. So we checked TSH, T4, T3, and T7. Had some indicators there. This is an optimal range. This is a clinical range right here. If you look at TSH 3.5, she was still within the generally accepted clinical range. We present these numbers to show patients that they're trending one direction or another. That can be useful if you're wanting to focus on prevention. T4 was 4.7 on the low end. T3 was 30, not a problem. So it really didn't point us in one direction or another. She had a fine needle aspiration of her thyroid on the left side, and the PA picked up that there was a nodule there. Aspirated that, and it was suggestive of autoimmune Hashimoto's thyroiditis, which is basically when the body starts attacking your own thyroid, which is never good. So I decided to do some follow-up tests, and these are typically never done. If you go out and have an annual blood work, these are usually, unless you request these tests, they're typically never going to be done. And this one showed up. This is an anti-TPO, anti-thyroid peroxidase test. Showed up as high. Hers was 69, normal. The reference range is 0 to 34. Great indicator to show that her body is starting to produce antibodies against the thyroid, meaning it's attacking the thyroid gland. When that happens, you're going to have all of those classic symptoms. There's two forms of autoimmune thyroid conditions. There's Graves' disease and Hashimoto's disease, which is autoimmune thyroiditis. So again, the reason I'm bringing this up is because the effects of inflammation, food sensitivities because of that inflammation, or food sensitivities that cause inflammation, can have a lot of downstream effects. But you don't have to take my word for it. Here's a Northwest Anti-Inflammatory Diet pilot study at OHSU, Oregon Health Sciences University, and NCNM. This is National College of Naturopathic Medicine, the school I attended in Portland, Oregon. They collaborated on an AI diet study. These are just the people that work together. It's a diet used to treat many chronic symptoms or diseases known as a hypoallergenic diet, meaning low allergies. It involves a strict elimination diet that excludes many ingredients commonly believed to be allergens or promoting inflammation. It's a diet that is high in foods with antioxidant properties, rich in polyunsaturated fats, and low glycemic index. So not a lot of refined sugars. The foods that are not going to be part of this are wheat, corn, soy, eggs, dairy, peanuts, shellfish. Foods thought to promote inflammation are, we've already talked about some of these: trans fats, nitrites, red meats, alcohol, caffeine, wheat, and a few others. Foods to emphasize: potential reduction of inflammation, ginger, garlic, turmeric, onions, beans, whole grains. High antioxidant activity is found in leafy greens, cruciferous vegetables, squash, sweet potato, tropical fruits, and blueberries. If you had to choose a great potato that didn't spike your blood sugar too much and doesn't make you too sleepy after lunch, that would be the potato right there. Fatty acid profile, looked for flaxseed, fish, olive oil, coconut oil, and tree nuts in this diet. So here's a nice little chart that shows what it is. In the grains, here's the things to exclude for the AI diet. Here's things to bring in. That's how you spell quinoa. I think that's kind of fun. Vegetables, all the different categories. You can kind of take a look at that. Good ones, not so great ones. Example of a day on the AI diet. There's breakfast, lunch, dinner, and snacks. Kind of looks different a little bit. A lot of those foods you're comfortable with, you've tried, maybe not for some of them. Here's the control diet. This means the regular diet. That probably looks a little more normal. All right. The participants had to be healthy, No psychiatric, renal, hepatic, or heart disease. They had to have a reference BMI within that range. They had to be pre-diabetic with fasting blood sugar greater than or equal to 100 milligrams per deciliter. They couldn't be taking Lipitor, lipid-lowering agents, NSAIDs, non-steroidal anti-inflammatories, other inflammatory inhibitors, aspirin, diabetes medication, hormone replacement therapy, oral contraceptives, testosterone, or seizure meds. So it's a pretty tightly controlled study. Those are usually the ones that mean the most. All visits at the Clinical and Translational Research Center, 6 weeks. All food and most beverages provided. Controlled diet based on ADA guidelines. First 2 weeks were a eucaloric diet. That's a diet that's based off of their exercises. So not eating more calories than they needed for the day. Followed by 4 weeks of pretty much eating however they wanted to. The way the intakes of all foods consumed. They were measuring nutrient consumption, body consumption, quality of life, glucose tolerance. Responses were, it was pretty challenging for all participants to eat everything during the eucaloric phase. Elimination of caffeine was tough, a lot of headaches, some gas, bloating, less than 1 week. Then it typically discontinued after that. Subjective reports of improved sleep, more energy, and less aches and pains. Those are all good things. Outcome of the data, the macronutrient consumption increased, the good, dense quality nutrients. Fatty acid intake increased, cholesterol composition improved, vitamin absorption increased, minerals increased, positive body weight changes, GI discomfort decreased, and overall increased health. Seems like a good diet for these participants. So, what are some takeaways? Natural medicine is aimed at stimulating the body's innate ability to provide the building blocks for optimal function. The digestive tract is the site of many crucial functions, including digestion, absorption of nutrients, waste elimination, and immune function. Inflammatory diseases can be improved by healing the digestive tract and making important dietary and lifestyle changes. So I think it's important to not underestimate the ability of healing the gut. There's so many key functions that happen right there. To not test is to guess. To test is to know. Know that there are ways to test. You can do the food allergy, the kind of the elimination provocation diet, where you're saying, hey, I think this food is bugging me. I'm not sure. I'm going to take it out of my diet for 2 weeks, and I'm going to reintroduce it for a couple days, and I'm going to see what happens. And you might be surprised what happens. Okay? You can do blood testing. You can do saliva testing. Testing for food sensitivities and allergies is available. And a little humor. So the patient comes, doctor, I don't feel well, and I'm not sure why. I want you to meditate for 20 minutes twice a day, exercise at least 30 minutes a day, avoid processed foods, eat plenty of organic fruit and veggies, spend more time in nature and less indoors, stop worrying about things you can't control, there's a big one, and ditch your TV. Come back in 3 weeks. Wow. No meds? Can't believe it. So feel empowered. Know that there's a lot of things that you guys can do if you have predispositions towards food sensitivities that you suspect. If you need extra help, know that that's out in the community as well. There's plenty of, there's a growing knowledge out in the community of providers that are interested in treating chronic autoimmune conditions. Any questions? I think you're getting sleepy.
What's the difference between a prebiotic and a probiotic?
Prebiotic is typically something that is going to convert into a probiotic. It's not quite there yet. So once it hits the gut, whether that's the stomach, small intestine, or large intestine, then it converts into the fully active form of a probiotic.
So it's a form of probiotic, it just doesn't.
Yep.
Do you recommend taking like the omega
fills the fish bones or?
I do, yeah. Typically, unless, you can test to find out where you're at with that, but most of us are deficient in that, in vitamin D. Not playing your doctor here because we don't have an established relationship in that role, because generally speaking, that's a good direction to head. If you're stranded on an island and you only had three supplements, 2 or 3 supplements to take, you do your vitamin D and you do your omega-3s and perhaps a multi, not necessarily. Yeah. Most of my patients that have a lighter colored skin that we test and that are usually professionals working inside of an office building, typically they're all deficient in vitamin D. The highest that I've seen, given that reference range we talked about as being 50 as being the minimal amount of vitamin D you want to have. I've seen patients, I was supplementing with vitamin D, having 89. They were great, really good. Another side effect of low vitamin D is going to be some gray mood, a tendency towards depression as well. So as we're heading into fall, we're going to lose kind of the angle of that sun. We're going to lose some of that sunshine. Something to think about. It has to be D3, it's not D2. Yes?
What's the difference between the omega-3 and the omega-6?
It's a difference in how they're converted. Omega-6s are more, it's the structure of the oil, different amount of carbons on it. Omega-6 is going to be less pro-inflammatory than omega-3. Omega-6s you're going to find in some of your grains. Omega-3s you're typically going to find in your flax, chia, salmon, krill as well. Omega-3 is typically the direction that we want to go because we're getting too many omega-6s in our diet.
If you do not eat fish.
If you do not eat fish, then
Never.
yes, it's okay. Then make sure, do you fish in your diet or fish as a supplement? Both?
Fish.
Absolutely not. Okay.
If it swims, I don't eat it.
Yeah, okay. You probably want to become comfortable using chia and flax, all of these anti-inflammatory foods that we've been talking about. Algae oil really is, the research shows it's the best right now, even above those two. Chia is second. So, chia comes from, you heard of the chia pet, right? Yeah.
Can you buy that just in a health food store?
Yep. I wouldn't typically go to a big box store to source your supplements or your anything that you're using as a potential mechanism of changing your body chemistry. This is too many fillers and dyes.
What do you think about DGL as a coach your stomach? Is that something that
DGL?
is a licorice food?
Okay.
Non-liquid?
DGL as a brand or as a name, I'm not. The licorice root I am.
Oh, okay.
Yeah, licorice root is fantastic. If you go to Tandoor, as you walk out, they're going to have licorice seeds, right? What a great way to calm your stomach. If you're prone to a high stress environment, I usually recommend my patients use licorice in the morning with any adrenal supplements we use for them. Between that 6 to 8 to 10 hour range is when you usually have that adrenal slump in the morning, particularly for females. And licorice can only help modulate or increase that cortisol production from your adrenal gland. So, any other questions? All right, thanks for being good listeners.
Thank you.